This lecture will cover the protozoa. So these organisms can infect the intestinal tract, blood tissue, and even other body organs or sites. Protozoa are unicellular eukaryotic organisms that possess different specialized organelle that help with their replication or transmission and survival. And most multiply by a binary fission type method. And with these organisms, the infection can be transmitted through ingestion of the infective stage of the protozoa, or through an arthropod vector, or through sexual contact. And then these organisms can be further divided into the amoeba, and so these will move through a pseudopoda. And then you have flagellates that move through via flagella. And then you also have ciliates, which have they move with cilia, and sporozoa, which are they do not have any obvious mode of motility. So this organism is not really divided by motility. So your amoeba contain a pseudopodia, which is a cytoplasmic type protrusion. So that's how they do move. So you can see like images number 9 where it kind of blobs out. So those organisms, or those shapes of those organisms, like 9 through 13, are more common what we see in the lab. These organisms are free-living. They can be pathogenic, or they can be a non-pathogenic type organism. They are found in the intestinal tract as well as other areas of the body. And so they are a motile trophozoite that's seen in stool specimens. And some of your more common pathogenic organisms include the Entamoeba histolytica, Naegleria falguarii, and Acanthamoeba. And so these organisms do cause specific disease infections with each of these. Entamoeba histolytica can cause the amoebic colitis or amoebic liver abscesses. And so with this disease, or with this organism, the disease state that it causes, the patient can be asymptomatic, or they can have vague abdominal discomfort, tired, weakness, diarrhea that can alternate with constipation, or they can also have bloody dysentery and fever, and this would be in cases of like an acute illness. So the pathogen invades the intestinal submucosa with a lytic enzyme, and so with this lytic enzyme it kind of destroys the tissue. And then there's a lateral extension that will lead to a flask-shaped type lesion within that mucosa. And then you can also have the amoebic hepatitis, where it's actually will cause an enlargement of the liver, fever, chills, leukocytosis, or increase in white blood cells. And so with this organism, it appears as like a finely granular cytoplasm that will have a small, compact, centrally located karyosome. And so when we talk about that karyosome, we're talking about inside here in this this little organelle right here, where you have the dot that's in the center versus being off to the side of that. So the location of that karyosome in that nucleus will kind of help to differentiate it from other non-pathogenic type organisms. And so these organisms can actually ingest red blood cells, because remember they do have that lytic, hemolytic type agent. And so they can ingest those red blood cells, and you can actually see those red blood cells inside of that organism. So with different detection methods, you've got your routine methods where you can just visualize it. You have antigen type methods, histology, nucleic acid type methods of testing through PCR or multiplex testing, and you also have serological type testing that can be done. And so the host is infected with ingesting the cyst of it, and then from there the cyst will go through a different process with inside of the host. The Acanthamoeba species will cause granulomatous amoebic encephalitis. And so this is a chronic form of meningoencephalitis, and this is when the infected patients will have usually a compromised immune system, and so the symptoms are usually very slow onset with weeks to months, sometimes even years. And then they will start to form a chronic granulomatous type lesion within the brain tissue, and that lesion will actually contain the tropozoites and the cysts. And then this organism can also infect the upper respiratory tract of healthy people. And so it seems like it grows best in the upper airways of susceptible patients as well. But this organism can infect you through either inhalation of something that's contaminated like dust aerosols, or it can actually enter through broken skin or mucosal membranes. And so it has been found in the lungs, nasal tract, sinus passages, ears, eyes, skin lesions, vaginal tract. And it's also been associated with amoebic keratitis. And so this is when you have direct exposure to the organism through some sort of contaminated material solution. And so this puts contact users at risk of getting this infection from that organism actually being contaminated in like this contact lens solutions, or just through handling of the contact lens itself. So this organism is diagnosed based on the cyst or the tropozoite stage being observed within the sample. And within that sample, you're looking for a very large nucleus with that little large central karyosome inside of that nucleus. So you can see that here, where this organism has that nucleus here in the center, and then you have that very large karyosome, whereas the previous organism, it was kind of like a little dot. This one's a little bit larger. And then also these organisms have a wrinkled type outside edge. You can't see it very well in this stain here, but the outside edge is kind of like folded, a double wall. It's kind of folded over, wrinkled around those edges, but you can see in this illustration down here at the bottom where you can kind of see those like folded, wrinkled type edges. So this organism can be diagnosed through different methods, through direct detection or visualization of the organism on a stain smear from a direct sample, through spinal fluid, bronchial lavage, tissue biopsy, or even something like the corneal scrapings where you're looking for that organism once it has infected the eye. Naegleria fowleri is an organism that will most often infect individuals during the summer months. And this is because the parasite gains entry through the nasal mucosa. And so this is introduced usually with the host diving or swimming in ponds or small lakes in which this organism is infected with. And it then will migrate along the olfactory nerves, and then within several days it will start to actually invade the brain. And so this organism itself is highly temperophilic. It can survive water temperatures up to 113 degrees Fahrenheit. It can also tolerate chlorinated water, so it has been found in swimming pools, even indoor swimming pools. And so this infection can also be acquired through drinking unfiltered chlorinated tap water as well, because it can be found in chlorine. And so the clinical symptoms will kind of present very dramatic, as it'll run a very rapid, very fatal course. And so the symptoms of the primary amoebic meningoencephalitis will begin with a headache, a fever, nausea, vomiting within a couple of days. And then after that you get the meningoencephalitis that can lead to like irritable behavior, coma, death. And so it usually lasts about 6 days or more, but it does have a very, very rapid progression. So it's kind of a high priority to make sure that this organism is diagnosed. And so this organism can have a couple of different forms with the trapezoite form. So it can actually be amoeboid, or it can actually develop flagella. So it does, kind of stand it out a little bit different from the other two, that it does develop those flagella. So the cysts are round with a double thick wall. You can see up here in the top image where you can see this organism with that very large nucleus there. And sometimes it can kind of be elongated. This image, it's not as elongated, but it does have a very large central karyosome within the nucleus. And so you can see that this one actually pretty much takes up the whole entire nucleus, where it's kind of all filled in. And sometimes you can have little vacuoles inside of this organism, but typically it may not actually be found until the autopsy is performed if it's not detected early. And so that's why it's very important to make sure that you're kind of aware of the patient's history when trying to diagnose this type of infection. We'll now discuss the protozoa that contain the flagella. And so these organisms will live in the gastrointestinal tract, bloodstream, urogenital tract, or even within various tissues. Your more common pathogenic organisms that we'll discuss will include the Giardia duodenalus, which has also been referred to as Giardia lamblia. So you may hear both terms. And so this is the cause of traveler's diarrhea. We'll discuss Trichomonas, which is the cause of trich. We'll also discuss the Trypanosoma, which is the causes of Chagas disease and African sleeping sickness, and as well as Leishmania, which causes leishmanosis. So with Giardia duodenalus, which is known to cause giardiosis or traveler's diarrhea, it is the most common of the intestinal infections worldwide. And so symptoms can include abdominal pain, foul smelling, diarrhea, gas. This is really foul smelling, like rotten egg type smell. It can cause irritation of the intestinal mucosa, where it can actually shorten the villi and the inflammatory foci within the intestinal tract. And then it can also cause malabsorption syndrome, which can happen if there's like a really heavy infestation. And then if you have people that are IgA deficient, they can tend to be more susceptible. And so with like your other things like dysentery and things like that, then the stool can contain red blood cells and white blood cells. This infection does not have that manifestation with it. And so it can turn into a chronic type disease as well. And so this organism is obtained through contaminated food and water. And so it will, once you're infected, then it will replicate within the intestinal tract, and it can be diagnosed based on the examination of the stool, different antigen or automated fluorescent type testing techniques, as well as like nucleic acid testing techniques. But if you're looking at it through the stool specimen, looking on a microscopic examination, you can actually see the trapezoite stage, where it kind of has a pear-shaped stage shape to it. So you can see here the trapezoite, and then you can see its little flagella coming down here at the bottom. And then what you're looking for with this organism is a very distinctive characteristic where it kind of looks like it has eyes. So you see here, it's a little hard to see with this green, but you can see where it looks kind of like it has eyes. It's looking back at you. And then sometimes, like in here, you can see a real prominent little body that looks kind of like a mouth smiling at you. And then, of course, the cyst type stage, egg stage, will look kind of similar. You can see more of these nucleoli, in it with the egg type stage here. So you can see in all of these images where you kind of see where the nucleoli kind of look like eyes, and then this little I think they call them median bodies maybe, but you can see these look kind of like maybe like a little mouth or something smiling back at you. Trichomonas vaginalis will cause Trichomonas vaginitis, urethritis, and trich infections. So with this organism, it's usually asymptomatic in men, but within women, it can be a persistent vaginal inflammation that may cause a yellowish, frothy, foul-smelling vaginal discharge with burning, with urination, itching, and irritation in the vaginal area. And so this organism can be diagnosed through a wet prep or a wet mount. It can be seen on a pap smear. It can also be detected through antigen detection methods. So there are some rapid kits out there that can detect this organism, and as well as through PCR testing. And so this organism is a pear-shaped a tropozoite it has very jerky, rapid motility. With the nucleoli, you can't really see those like a wet mount, so it just has to have one nucleoli. And then it also has several flagella around it, and so you can actually see those move on the wet mount. And so it can be seen in the urine, urethral discharge, vaginal smears. And what you're looking for is that undulating membrane that kind of goes around the body of the organism. So you can kind of see it moving, like it looks like a little thread kind of moving. And then and you can also see the flagella that are kind of moving around that helps with that movement. So on a wet mount, you can see here at the bottom where it's kind of got like a little pear shape here. There's two of them actually side by side, so there's one there. And then this one you can see those flagella really well. And then of course over here you can see the stain with the nucleoli, and you can see all those flagella and undulating membranes. And this would be like with a pap smear or a stain smear that you might see this. So here we have a picture or a video of the organism itself with it moving. You can see there where you have all those pear-shaped organisms that are kind of moving around. You can see a lot of those little flagella. They're very active, so you can see these in a vaginal wet mount or with urethral discharge, as well as you can see these also in urine specimens, and occasionally you can find them in fecal specimens as well. So you can see a lot of those flagella that are kind of moving around from the backs of them, that's helping with its motility. So you can see it kind of tumbling around, and some of them as they turn, you can see that undulating membrane that kind of runs down the side of it. So next we'll talk about the trypanosoma. So this organism again does have that little flagella on it, and you can see an image here where it's kind of developing that. And with this organism, it does cause either African sleeping sickness or Chagas disease. So you may be familiar with hearing Chagas disease over the more recent few years of that becoming more of an issue within the United States. American trypanosomiasis, also known as Chagas disease, is caused by the
Chagas disease. Chagas disease. Chagas disease.
So when we're looking at it under the microscope to detect T. cruzi, we're looking for, of course, on blood smear because it does infect the blood. And so you could do thick or thin smears, or it could just be reviewed in hematology. Sometimes your automated machines aren't going to flag something like this. It may not recognize that there's a parasite in there, or it potentially could. So sometimes if it's suspected, then the physician may order a blood smear review. Then there, of course, are automated testing methods, antigen testing methods for this organism as well. But what you're looking for is this very large terminal kinetoplast. So it looks kind of like a little eye. So these organisms look sort of like a seahorse. But you can see at the end here where this is a very large kinetoplast, and so that's what makes this one more distinctive from the next. So with your African trypanosomyces, this one's caused by the Trypanosome brucei. And so with this organism, what makes it look different is you have the very small kinetoplast. So with this one is caused by the tsetse fly. But you're going to see this one more in Africa. So you may not see it a lot in the United States, but when you have a lot of the mission trips, then your patients may return home and actually have this organism. But you can see that the difference where that little eyeball-looking structure is smaller for the one that's caused by the T. brucei. And so with this illness, again, it can be acute or chronic, and this one may invade the central nervous system and cause issues there with the patient because of the central nervous system infection. So with that, you can get like fever, headaches, night sweats, lethargy, changes in the motor aspect of the patient, coma, and even potentially death due to cardiac failure. So again, most of these organisms, just like many things that we deal with in the microbiology world, need to be suspected and diagnosed right away. So this is where patient history comes into play as far as helping to aid in diagnosis. So there are a few different Leishmania organisms that cause different disease states. So there are organisms that can cause cutaneous type lesion, which can cause like a boil type lesion. And so with this one, it will actually cause a pus-filled lesion on the body. And they're usually self-healing, but they can cause a potential for a very lasting infection, as far as being able to be cross-contaminated with other organisms. Then you can also have one that will cause a mucocutaneous type infection. And so with that organisms, again, you can kind of have like a red, itchy type lesion that will metastasize to the lymphatic type infection. And so again, these are usually self-healing, but it can cause a disfigurement of like the nose and the ears if it turns into like a chronic mucosal type irritation or ulceration. And so a lot of these are mostly seen in other countries, but of course, travel can cause exposure for someone to bring something like this back. And then you also have a visceral type involvement. And so with this, you can get like an irritation at the bite site, and then from there it can kind of give like a malaria type presentation with chills, fever, sweating, diarrhea, dysentery, weight loss, splenomegaly, hepatomegaly. And then from there you can get your various organ involvements, and then it can progress to an anemia. And then if it's left untreated, the patient can actually die within a couple of years. So diagnosing this organism, you're looking for an intracellular type parasite where it actually invades the cells. So you can see in this top image where you have some white blood cells that have been invaded with that organism. And then as far as diagnosing this organism, it can be looked at under a direct smear, or you've got some other testing methods in which, like a rapid testing method or dipstick type testing method, something like a pregnancy test, where you're looking for the antibodies to it. And then of course there's also like PCR testing. Your ciliates can multiply asexually or sexually. And with these organisms, they have an ectoplasm cilia that cover the surface of the cell or the organism. And they also have two nucleoli. So they have a macronucleus, which is a larger nucleus. It's a kidney bean type shape. And then they have a micronucleus that's very small. And so with this organism, there's really only one that we'll discuss as far as being a pathogenic type organism. So this would be Balantidium colea. And so with this organism, it's the only ciliate that will actually infect humans. And so with this infection, it's very rare in the United States, but it is associated with being exposed through pigs that have been contaminated or that are contaminated with this organism. And so what it does is it will actually invade the tissue and start to form ulcers. So the disease can be asymptomatic, but once if the patient does develop symptoms, it's usually like abdominal discomfort with mild to chronic recurring diarrhea or acute dysentery. So healthy individuals aren't as likely to be infected with this organism, but it can be seen. And so what you're looking for is the two nucleoli within this organism. That's because you've got the micronucleus and the macronucleus, and of course that macronucleus is that kidney bean shape. It's a little bit harder to see that micronucleus because it is so small, but you can see it. So here you've got some images where you can actually see those cilia for this organism here at the bottom in this wet mount with iodine. You can see the little cilia off of the outside wall of that cell, so that's very characteristic, along with this little kidney bean type shaped nucleus. You can see that real good here as well. Next we'll cover the sporozoa. These are obligate endoparasitic protozoa, and they don't have any sort of organelles that help with their locomotion or their movement. They are unicellular, and they produce sexual and asexual. And we've got several of these organisms that we're going to cover. The Cryptosporidium species, there are a few of them, but we're just going to cover them as a group. So they are acquired through contaminated water or through someone else that may be infected. And so these organisms will actually infect the epithelial cells of the gastrointestinal tract. And so usually it's acute diarrhea that the patient will present with. However, it is a self-limiting infection with patients who have a normal immune system, so it can last 1 to 2 weeks. But those oocysts are what actually infects the patient when the patient ingests those oocysts. And so those are shed. They can be continued to be shed even after the patient has kind of recovered from the infection and the diarrhea has ended. So making sure you wash your hands very well. It's a good reason. It's because of this organism. In your immunodeficient patients, like your HIV patients or those that are immunosuppressed, cancer patients can develop chronic diarrhea after being exposed to this. And then you can also, with your HIV or AIDS patients, they can also develop a respiratory cryptosporodius infection. With this particular infection, it has been associated with different outbreaks through contaminated, like drinking water or unpasteurized apple cider. So, like the apples may have been exposed to the actual organism, and then when the apple cider was made, the organism presented into that. So you do see this a lot with different contamination, different food supplies, water supplies, vegetables. So you do see this occasionally with the Cryptosporidium outbreaks. Cyclospora cayetanensis is transmitted through fecal-oral route, and it can be linked to like fresh produce. So with this infection, the patient will demonstrate with a influenza-like illness with nausea, vomiting. They can also have explosive diarrhea. And it's also been associated with a biliary disease. So this infection is usually also self-limiting diarrhea that can last 3 to 4 days, but you can have episodes of relapse. And there have been outbreaks with this as well, which has been associated with like drinking water, stagnant water off of like rooftops, things like that. And so with this particular organism, as well as the last one, they're best visualized looking for those oocysts in an acid fast stain, but there are also automated methods that can assist with identifying this organism. Your Plasmodium species are the organisms that will cause what we more commonly refer to as malaria. And of course, they're transmitted through a mosquito bite. And so with these organisms, the parasite actually infects and feeds on the red blood cells, the hemoglobin within those red blood cells as they mature. And they go through various stages of development inside of that red blood cell. Now, I'm not expecting you to know the differences between these organisms or the different stages of them, so to speak. Maybe just be able to recognize it based on the visual appearance of it. Because it takes a lot of training even for the lab techs to be able to distinguish these organisms because they're so similar during these stages, but how they look in certain stages of development is how part of how they're identified, as well as with some automated methods now. And so they do go through various stages of development within that red blood cell itself, as far as replication, and then eventually rupturing out of that red blood cell and starting the cycle over again. Plasmodium vivox. Again, with these organisms, I'm not expecting you to know very distinct details on how to identify them because it is very difficult. But, most of these organisms are found in the tropic, subtropic type area. But with Plasmodium vivox, it can cause splenomegaly within a few weeks of infection. And so these organisms are identified based on its characteristics on microscopic examination. So the tech would be looking for, with a differential or CBC blood smear, they're looking for these organisms to be infected inside of these red cells. So the shape of it, the size of it, the appearance of it inside of these cells, and you can see several of these, is what helps with diagnosing it. And so in these over here are all different characteristics that are used to help diagnose it. So I'm not expecting you to know these in detail, but if you're presented with a picture and it's got something that looks similar to these, then you would just need to say that it's a Plasmodium species. The Plasmodium ovale, again, these are found in like your tropic type areas. and you can see some of these characteristics. They look very similar, but they are different as far as how they happen in these red cells within this patient. And so these organisms again can affect the organs within the body in different ways, but they're always going to invade those red blood cells. Your Plasmodium malariae. So with this one, it can be associated with a nephrotic syndrome, proteinuria. Again, you're kind of looking for these little ring forms inside of these red blood cells. Plasmodium falciparum, and so this one stands out a little bit different because it has this like banana shape gametocyte within this organism that you're looking for, crescent shape, banana shape, and so this organism can actually cause complications because it can actually plug the vessels of the organs, and it can cause fatal complications. So this might be referred to as something like DIC, the disseminated intravascular coagulation, or black water fever. So, you know, because of those complications and because of this particular organism being deadly, it is very pertinent that it's diagnosed right away, or as soon as it's suspected. Plasmodium knowlesi is the cause of Lexamoyum malaria. And again, you can kind of see that ring shape that this organism will form. And so with these infections, again, it does take a lot of training to be able to dictate which organism is which. And so there are some automated methods that assist with this nowadays too. So it's just kind of giving you a comparison of how they look as far as what the technician's going to look for. And they're looking at the size and shape of this little ring. They're looking in the background of this cell to see if they see any of those little Schiffner's dots. So you can see with this one has a lot more of them. They're more spread out within that cell. This crescent shape here. So there are different characteristics that you're looking for to be able to distinguish one from the other. How this little ring form looks and how this little part here looks. Again, here they're all just kind of compared out within the different phases of how they're going to look. So you can see that kind of all end up looking very similar in the endpoint of this infection. You're going to make thick and thin smears. There are also rapid detection methods, PCR detection methods, automation, and then just something interesting to point out, since you've probably have heard about it more recently, is the treatment here, because you do have some chloroquine resistant Falciparum species that has caused problems, but you've probably heard this here a lot in the past year or so as far as treatment for COVID. But it has been a drug of choice for treatment of malaria, although there is some resistance with the Falciparum. Babesia is transmitted by a tick bite. Its life cycle is very similar to the Plasmodium. And so it can look very similar, but what stands this one out from your Plasmodium is this Maltese cross look. So you can see where it kind of semi-forms like an X or a cross. And so that's what's very characteristic of this organism, and what you're looking for when looking at a smear to try to diagnose this. Toxoplasmosis gondii. This is usually seen in patients who are immunocompetent. There's no clinical symptoms that's really observed in most patients, so some patients are usually exposed to this and kind of self-limited, but however in some patients it can cause an acute infection or within their lymphatic system. But with patients that are immunocompromised, it can cause a central nervous system involvement, myocarditis, pneumonitis. It can be seen with these patients. But one thing that you may have associated this with, or you may be familiar with it, is like a toxoplasmosis infection when mothers are exposed to it during pregnancy. And then what can happen from there is it can actually infect the infant or the fetus, but it can also cause within the mom fever, enlarged lymph nodes, then infection within the fetus. So it can actually cause an infection to the point of death. And so it's kind of important. This is why you hear people say for expectant moms to not change cat litter, to reduce the risk of exposure. But it's also believed that if you may have already been exposed, if you've had a cat for a while, then you've already been exposed to it, so there's probably not much risk of actually getting the infection of this organism. And so it can be also cause an ocular infection as well. And so with this one, the patient can be exposed again, like I said, through the patient acquiring the infection through the oocyst, through exposure, probably like feces of cats, and then that's when that infection starts within the host. And so this infection can be diagnosed with different serological methods, looking for those antibodies or those antigens, and PCR testing, looking at the direct specimen. And there are some like tissue cultures and stuff like that can be done, but those are less common.